Every administrative decision comes down to a single moment. Before the ink dries on a policy mandate, a civil servant weighs human lives against systemic limitations. The gates of the Union Public Service Commission filter for candidates capable of making grueling resource choices under overwhelming pressure. Consider a directive issued in July 2026. The government mandate was absolute. Healthcare services must reach the absolute last person in society. That single line creates an immediate administrative collision. The directive demands total universal reach, yet the bureaucratic machinery you operate within evaluates your performance based on rapid, quarterly statistical targets. The ability to resolve this friction distinguishes an elite policymaker from a standard bureaucrat. You have to satisfy the constitutional demand without breaking the hierarchical system. You are appointed as a health officer in a district with a capped budget and a staff stretched to the breaking point. This map models your jurisdiction. Group A is a dense urban population where minor health camps trigger immediate statistical spikes. Group B occupies remote tribal settlements. High maternal mortality is concentrated here, but interventions consume time and money while producing invisible short-term data. Your superior officer orders you to direct your resources to Group A. The department needs a flawless quarterly report for the media, and Group A provides the easiest numbers. Complying produces a successful report, while the physical human cost compounds silently in the remote settlements of Group B. You know where the real crisis is. You must now construct a logically sound defense for rerouting limited state funds away from a direct order. Complex resource allocation requires isolating the specific ethical variables causing this friction. We map these fault lines on a 2x2 matrix. The first quadrant marks the collision between your duty to a superior officer and your internal conscience demanding public welfare. The second quadrant captures the clash between strict mathematical equality, giving everyone the same budget, and true equity, which requires giving more to those in deeper deficit. The third is the tension between short-term optics for the media and generating long-term sustainable impact for the district. The final quadrant completes with moral courage, highlighting the center intersection of all four variables. Defending an unpopular, mathematically difficult allocation requires assuming both personal and professional risk. A viable policy response engineers a structural solution that neutralizes all four of these variables simultaneously. To solve the equity variable, we apply the philosophical architecture of John Rawls' difference principle. This flowchart tracks a standard 50-50 budget split. The high terrain and logistical costs in Group B consume their funding before actual medical care is delivered. Their health outcome line stays flat. This gap shows how baseline equality starves the tribal population. Applying equal distribution to unequal starting points makes the system effectively unfair to the most vulnerable. Rawlsian equity mandates a skewed distribution. Shifting the concentration of resources to Group B pushes their outcomes above the survival threshold, while keeping Group A stable. Under Rawlsian logic, this skew in resource distribution represents the highest form of systemic justice. We can now translate this theory into a 4-point operational blueprint. Point 1. Data-driven reallocation. You redirect capital to Group B, citing mortality rates to justify the shift, while scheduling low-cost maintenance for Group A. Point 2. Establish innovative bridges. You deploy mobile health units, telemedicine nodes, and local ASHA networks to bypass the physical friction of the terrain. Point 3 manages the upward dialogue. You present the superior officer with a predictive data model showing how these tribal interventions will yield a massive drop in district mortality by year-end. You force the hierarchy to look past the current quarter. A verifiable reduction in extreme poverty metrics builds long-term institutional credibility. By grounding your ethical choice in mortality data and efficiency metrics, you transform an act of potential insubordination into a defensible policy shift. The empirical evidence provides the protection necessary to sustain the moral choice. Arriving at the correct action is only half the battle. Auditors and examiners evaluate the precise ethical architecture you use to support your decisions. This blueprint is anchored by Mahatma Gandhi's talisman. The talisman functions as an internal metric. It demands that whenever you are in doubt, you recall the face of the poorest person you have seen, and ask if your next step will restore their control over their own life. In professional analysis, Misattributing philosophical frameworks degrades the credibility of your argument. Policy analysts frequently confuse the talisman with Deen Dayal Upadaya's concept of Antyodaya, the upliftment of the last person. Gandhi's talisman is an individual mechanism for navigating personal moral doubt. Antyodaya is a Makla socio-political framework designed to structure entire economic policies from the bottom up. Operating with this level of academic precision separates a functional response from the masterclass in policy analysis. We started with a paradox: the mandate to serve the absolute last citizen versus a rigid order demanding cheap, visible success. By aligning Rawlsian mathematics with Gandhian heuristics, we engineered a data-driven defense that dismantles the pressure of short-term optics. This is the reality waiting for you. Apex government leadership requires choosing the statistically complex right over the politically convenient wrong. Internalize this analytical framework, map the fault lines, apply the philosophy, and let the data dictate the resource flow. Public service requires engineering justice for the very last person in line.